There are various common symptoms of illness in dogs, but some of them are serious enough to suggest the problem may be fatal. As a veterinarian, I've seen firsthand the heartbreak of losing a beloved pet. In this video, we'll be discussing 10 signs that your dog may be nearing the end of their life. It's important to remember that these signs are not always indicative of death, and some may be treatable with proper veterinary care. If your dog is exhibiting several of these symptoms, it's crucial to contact your veterinarian immediately. When a dog is nearing the end of their life, they may start to exhibit some unusual behaviors. One of the most common behavioral changes you might see is a decrease in physical activity. Your once energetic companion might seem tired all the time, uninterested in their favorite games of fetch or walks around the block. This lethargy can be accompanied by a noticeable personality shift. A normally playful and social dog might become withdrawn and quiet. You might observe increased anxiety, fear, or even aggression, even in situations where they've never shown such behavior before. These changes can be subtle at first, but they often become more pronounced as their condition deteriorates. If you notice any sudden or gradual changes in your dog's behavior, don't hesitate to schedule a checkup with your veterinarian. They can assess your dog's overall health and provide guidance on how to best support your furry friend during this difficult time. As a veterinarian, I can't stress enough the importance of being familiar with your dog's normal vital signs. These include their temperature, heart rate, respiratory rate, and gum color. Dehydration is a common issue in dying dogs, and it can manifest as dry gums, sunken eyes, and loss of skin elasticity. Excessive panting, even when the dog hasn't been exercising, can be another warning sign. Abnormal body temperature is another red flag. A dog's normal temperature ranges from 101 to 102.5 degrees Fahrenheit. Monitoring your dog's vital signs doesn't require any special equipment. Early detection is key when it comes to managing any health issues, and being proactive can make a world of difference in your dog's well-being. We all know that dogs love their food, so when a dog suddenly loses interest in food or refuses to eat, it's a cause for concern and could be a sign that something is seriously wrong. This loss of appetite can be particularly alarming if you offer your dog something they usually can't resist, like a tasty piece of cooked chicken or their favorite wet food, and they still refuse to eat. Dehydration can quickly become a serious problem in dogs who refuse to eat or drink. If your dog isn't eating and refuses to drink water, it's crucial to seek veterinary care immediately. If your dog's loss of appetite lasts for more than 24 hours, or if you notice any other concerning symptoms like vomiting, diarrhea, lethargy, or weight loss, don't hesitate to contact your veterinarian. They can perform a thorough examination and determine the underlying cause of your dog's lack of appetite. Chapter 4: Lethargy. Lethargy in dogs can manifest in various ways, and it's essential to recognize the signs. If your usually energetic companion seems unusually tired, sleeps more than usual, and shows little to no interest in their favorite activities, it's crucial to pay attention. When lethargy is combined with other symptoms we've discussed, such as loss of appetite, changes in behavior, or altered vital signs, it could potentially be a sign that your dog is nearing the end of their life. While witnessing these changes in your beloved pet can be incredibly difficult, it's essential to create a comfortable and supportive environment for them. Provide them with a soft bed in a quiet area of your home, ensure they have access to fresh water, and offer them gentle words of comfort and reassurance. Chapter 5: Incontinence. Incontinence, the inability to control bladder or bowel movements, can be a distressing symptom for both dogs and their owners. While it can affect dogs of all ages, it's particularly common in senior dogs and can sometimes be an indicator of approaching death, especially when accompanied by other signs of decline. Incontinence can also be caused by underlying medical conditions, such as urinary tract infections, kidney disease, hormonal imbalances, and even cognitive decline. If your dog suddenly becomes incontinent, it's essential to schedule an appointment with your veterinarian as soon as possible. They can determine the underlying cause of the incontinence and recommend the most appropriate course of treatment. Chapter 6: Vomiting. Vomiting is a common symptom in dogs and can be caused by a wide range of factors, from something as simple as eating too quickly to more serious underlying medical conditions. When a dog is nearing the end of its life, their bodily functions, including digestion, begin to slow down and become less efficient. If your dog is vomiting frequently, or if the vomit contains blood, bile, or a foreign object, it's essential to seek veterinary attention immediately. Persistent vomiting can lead to dehydration, electrolyte imbalances, and malnutrition, further weakening a dog's already fragile state. By working closely with your veterinarian, you can help determine the underlying cause of your dog's vomiting and provide them with the appropriate care and support. Chapter 7. Abnormal breathing. Changes in your dog's breathing patterns, especially if they are sudden or drastic, are always cause for concern and should never be ignored. One of the most alarming signs is when a dog's breathing becomes shallow and rapid, and their chest seems to heave with each breath. This type of labored breathing can indicate fluid buildup in the lungs, a condition known as pulmonary edema, which can be caused by heart failure, pneumonia, or other respiratory ailments. Another red flag is noisy breathing, such as wheezing, crackling, or gurgling sounds. If your dog is struggling to breathe, it's crucial to remain calm and transport them to the nearest veterinary emergency clinic as quickly and safely as possible. Early detection and treatment of respiratory problems can significantly improve your dog's chances of recovery and enhance their overall quality of life. Chapter 8. Increased dependency. As a dog's health deteriorates, you might notice a significant shift in their behavior, particularly in their level of dependency on you. Dogs who were once independent and content to spend time alone might become unusually clingy, following you from room to room, seeking constant physical contact, and becoming distressed when you're out of sight. This increased dependency can stem from a variety of factors, including physical discomfort, disorientation, anxiety, and a heightened need for reassurance and comfort. While it's natural to feel heartbroken witnessing your once independent companion become so reliant on you, it's essential to approach this change with empathy and understanding. Offer them extra cuddles, gentle strokes, and soothing words of reassurance. Chapter 9. Gum discoloration. A dog's gums can provide valuable insights into their overall health, acting as a window into their circulatory system. Healthy gums should be a vibrant pink color, similar to the color of bubblegum. Any deviations from this healthy pink hue, such as paleness, bluish tinge, or a yellowish discoloration, can be a red flag that something is amiss and warrants veterinary attention. One of the most concerning changes is when a dog's gums become pale or white. This paleness often indicates poor circulation or a decrease in red blood cells, which can be caused by various factors, including anemia, blood loss, shock, or even poisoning. If you notice any significant changes in your dog's gum color, don't hesitate to contact your veterinarian immediately. Chapter 10. Seizures. Seizures in dogs can be terrifying to witness, leaving pet parents feeling helpless and scared. During a seizure, a dog might exhibit a variety of signs, including loss of consciousness, involuntary muscle contractions, loss of bladder or bowel control, salivation, and disorientation. Seizures can be triggered by a wide range of factors, including epilepsy, brain tumors, toxins, metabolic disorders, and head injuries. If your dog experiences a seizure, it's essential to remain calm and take the following steps. Ensure their safety by moving any objects that could potentially injure them during a seizure. Do not restrain them. Allow the seizure to run its course without trying to restrain their movements. Time the seizure. Note the start and end time of the seizure, as this information can be helpful for your veterinarian. Contact your veterinarian immediately. Even if the seizure is brief, it's crucial to seek veterinary attention to determine the underlying cause. Seizures themselves are not a disease but rather a symptom of an underlying problem. By working closely with your veterinarian, you can help determine the underlying cause of your dog's seizures and provide them with the appropriate care and support. Outro: what to do if you see these signs. If your dog shows all or any of these signs, it's important to speak to a veterinarian. Although these symptoms may indicate that the dog is close to death, they are also symptoms of different pathologies and diseases. Early intervention can often make a significant difference in the outcome, and in some cases, it can even save your furry friend's life. Please know that it's okay to grieve the loss of your furry friend, and don't hesitate to reach out for support from friends, family, or a professional grief counselor. We appreciate you watching, and we'll see you next time.